An EXmedic biller reports a difficulty entering a specific diagnosis code for discharge. The diagnosis code is N40.1. Tab, and indeed it doesn't accept it, which means EXmedic processed the validity of this code and concludes that under this environment this code is not valid. First of all, we can go into the diagnosis and verify if that code exists. If we have it, we do have it. It's billable. Okay, so this looks okay. Then there must be other criterion that are in place. The tests that are being performed here can be disabled. So if I do N40.1, I now push the shift key and then tab out, I do get it, which indeed confirms that the additional verification did reject the N41. So what could that be? Let's go back to that diagnosis. These labels here do constitute additional criterion, and what we see here is that this is a male only diagnosis code. Okay, we go into the patient, and what do we see? The patient is determined as being female. So that's the reason that correctly EXmedic did reject that code. Now we do it again, and now we have it. Why did we not get a message warning us about that incompatibility? We go into preferences, charge preferences, and we have here inform the operator of rejected diagnosis for label incompatibility. We switch this on. Go back. We restore the error. We type in N40.1, and now we get the warning. So why would this warning be switched off? Well, because if there is a larger number of possibilities, like for instance, let's increase the selection. See, now because we have less digits, so we get more possibilities. It is possible that one of those will pass, while the others don't. And that's why it may be handy not to be distracted by the rejections as long as you get a positive. And in this particular case there was no positive, so then indeed the operator needs to make it his or her own determination. So that's the reason why that preference is often off, because in a large majority of cases, if some diagnoses are determined to be inappropriate, there are enough positives to justify the eventual billing codes.